I've noticed that people who work in the health benefits industry call customer service phone numbers a lot more than the general population.
I would agree with that.
Welcome to Under the Coverage,
During each episode, we interview people, sometimes it's just each other,
who spend their working days focused on health benefits and health care.
As consumers, we want the same thing you do.
We want the entire system to be less complicated.
Our guests share insights about how they navigate healthcare and the health benefits systems. I'm Jolene Myers.
And I'm Sarah Flusky.
And we're ready to lament,
complain,
empathize,
and maybe help a few people.
Today, we are lucky to have Barb with us. She has more than 20 years of experience in the health benefits industry. She's worked in claims, medical management, intake, operations, and client account management. So she really has a broad view of the internal workings of benefit plans. And after 20 years, she's still learning. We're in a state of constant change with new laws that regulate plans, new technology to improve administration and the member experience, and new benefit plan designs. So at the end of the day, Barb is smart, thoughtful, and a really great colleague, so we knew she'd be able to share some wisdom with us.
Welcome to the podcast, Barb.
Hi, ladies.
All right.
You have a really well-rounded view of the behind-the-scenes work of the benefits industry. We knew you'd have some great nuggets to share with our listeners, and we asked you to join us today to talk about the most exciting part, claims. So to level set, in your words, if you could first explain to our listeners what a claim is and how would you explain what that means to a member?
Yeah, so thank you for having me on. In regards to what is a claim, simply put, a claim is a request for payment that either you or your healthcare provider submits to NOVA or your carrier when you have services provided. Services are anything from routine office visits to an inpatient stay and everything in between that.
Good definition.
It is. So what do you know about claims adjudication coding that helps you better navigate your own benefits?
I would say what's most important for understanding your plan and how the benefits work would be to talk to your benefits administrator at your employer. Oftentimes we get claims in-house and we process, and unfortunately there's a denial for services that are covered, and you may not know that. And when you get the EOB or explanation of benefits, you're confused as to why we didn't make payment on it. So the best thing, like I said, was to get a summary of benefits from your employer to have a better understanding of your coverage. And always remember, our care navigation team is here for you. So if you have benefit questions before you get services rendered, they can tell you what's covered and what is not.
So one thing I want to step back on is the life of a claim, because we had a conversation not long ago where we talked about understanding in-network and out-of-network benefits, because for a mammogram, which would be a covered benefit that applies to in-network providers. So you could have an issue with your claim where it's not covered and you would expect it to be covered if you aren't getting that service done at an in-network provider. So network could cause an issue. Using an in-network or out-of-network provider could cause an issue with the claim. So I feel like with everything that seems like it should be easy, there's a little bit of something. I also want to say, Jolene, I think as a trend, I've noticed that people who work in the health benefits industry call customer service phone numbers a lot more than the general population.
I would agree with that.
Call and ask the question. I think that's been a theme in a lot of our episodes so far, just to kind of understand what you're looking at and how it all kind of connects and will impact you. Well, thanks so much, Barb. We appreciate all of your insight, as always.
Yes, your time and your understanding of kind of the nitty gritty of how those things work. I'm sure it makes a big difference in how you use your benefits. And I'm thankful that you could share it with us.
Thank you, ladies, very much.
This podcast was brought to you by Nova Healthcare Administrators.
Do you have a question or a situation you'd like advice about?
You can find us on Twitter at UNDR_the-coverage.
If you're into email, you can reach us at podcast@novahealthcare.com.
Don't forget to leave a review, give us a like, or subscribe, but more importantly, share.
We'll find the insiders. You share it with the outsiders.